Dear ladies and gentlemen, dear all, let me start by thanking you for the invitation to take part in this important conference on the family-centered early childhood intervention. I'm very sorry that I could not be with you today in person in beautiful Tirana. I hope the weather is nice, but I'm grateful for the opportunity to address you with this message. I would also like to say a few words on our policy at the EU level and on our funding instruments to advance the early childhood intervention services in support of the inclusion of children with disabilities and their families. As you know very much, this is an important topic for Europe of equality and for Europe that, as we often like to say, leaves no one behind. It is reflected throughout the European Pillar of Social Rights, and in particular, let me draw your attention to the Pillar Principle 11 on early childhood education and care, to Pillar Principle 17 on inclusion of persons with disabilities, and Principle 18 on long-term care, as well as a very important document at the EU level, which is the EU Strategy for the Rights of Persons with Disabilities. This strategy, we like to say, is our tool to improve the lives of persons with disabilities in the EU. It is our roadmap to 2030 to ensure that all children and adults with disabilities can really fully and equally enjoy the rights and participate in all areas of life throughout their lives. A key aspect to this is the right to independent living. And the strategy recalls the support that children with disabilities and families need, in particular when it comes to preventing institutionalization and accessing the social protection. The family-centered approach and to early childhood intervention systems, which is promoted in this conference, placing families and their needs in the center of the support, is in line with the calls from the Strategy for the Rights of the Persons with Disabilities to strengthen the transition from institutional care to community and family-based care services for persons with disabilities, including children with disabilities, mainstream support services, as well as education, housing, healthcare. They need to be inclusive and accessible for children with disabilities and their families. As a flagship initiative of the strategy, the Commission is going to issue a guidance to Member States on how to achieve improvements on independent living and inclusion in the community and to advance the institutionalization processes of persons with disabilities, including children, of course. Early childhood intervention services are really seen as a key to prevent the institutionalization of children with disabilities and to ensure their inclusion later in life. Developing the conditions for independent living and progressive closing down of institutional settings are processes that need investments. EU funds can play a crucial role in achieving these objectives, and EU funds have been playing a crucial role in achieving these objectives, I would dare to say, for at least more than 1 decade, if not already from 2010 and 11 when UNCRPD Convention was adopted. Promoting the institutionalization remains a priority for the Cohesion Fund in 2021-2027, and it is supported by enabling conditions for funding which is set out in the Commission Provision Regulation. Next to the shared management funds and structural funds, the technical support instrument, so-called TSI, can provide a targeted support for reforms of social services and the long-term care systems. Member States can also plan relevant measures in their, and are planning relevant measures in their recovery and resilience plans. Last, let me remind you on one very important initiative that is relevant for children with disabilities. It is the European Child Guarantee Recommendation. This recommendation puts children with disabilities in the heart of its activities and the actions. The EU pilot program that was run by UNICEF demonstrated that early childhood intervention services works and are beneficial for the children and for the families, and actually for the entire communities when it comes to the inclusion of children with disabilities in the society. The European Child Guarantee also asks for free and effective access to early childhood education and care, education, healthy meal per day, and also to health. These are all relevant for children with disabilities as well. And we also ask for effective access to nutrition and to housing. Also, I believe all of us agree that these are one of the most important aspects of inclusion of children with disabilities in the community. With this, I would like to conclude, and I wish you very fruitful discussion, and I can assure you that my colleagues and I are fully committed to working towards, with the member states, with the stakeholders and the international partners, on our common interest in improving the lives of children with disabilities and their families across Europe and across the world. Thank you very much.